So good afternoon, everyone. It's 4 o'clock right now, so we're going to get started in the interest of time. So welcome to our postnatal care in a pandemic webinar series. The topic for today is supporting perinatal mental health. And so this is part one of two webinars on the topic of perinatal mental health. The objectives of our webinar are to learn about priority concerns related to perinatal mental health that were identified through the recent CMNRP postnatal care rapid response data collection, to develop awareness about available mental health resources in the region, to describe features of innovative mental health initiatives in the region, and to identify tips and tricks for providing virtual mental health counseling and support. So I think a lot of you know who CMNRP is, but I wanted to just give a brief overview of the Champlain Maternal Newborn Regional Program. We are a regional integrated program whose whole purpose is to work together to achieve the best health outcomes for families in Eastern and Southeastern Ontario. And the way we do that is by working in partnership and collaboration with our partners and colleagues. And so our partners range from hospitals, public health, community health centers, midwifery practices, research institutes, academic institutions, anybody who's in the world of maternal newborn care. Do this to build a high quality system so that patients will have the very best experience and have optimal pregnancy, birth, and postnatal outcomes. So you can learn more about CMNRP by looking at www.cmnrp.ca. Look at some key documents like our strategic plan and some of the things that we've been focusing on, as well as some professional development opportunities and other resources. What we're talking about today is an example of how we come together to work to improve the healthcare system. And when the pandemic is happening, it identified fairly early that there were needs that were not being met for families in our region after they were having their babies. So we were hearing from care providers and families that they were not able to get the follow-up care after birth. And so we were asked to form a task force to look at this issue. And so you can see here listed the task force members. And so this task force was co-led by Dr. Daisy Moores, who's a family physician from the Ottawa Hospital, and myself. Some of our presenters, like Amanda DeGrasse today, was a task force member. So we do appreciate and acknowledge all of these organizations who contributed and supported these members to be involved in this work. We formed the task force in late June, and throughout the summer, we were busy working on these activities. And some members actually were doing this on their own time. So we definitely appreciate everybody's contributions and insights to this really important work. So there were three key activities that the task force were involved with. The first one was creating a healthcare provider survey, which I'll give you some of the results from. And then we were soliciting examples of innovations. So how were people responding to the COVID pandemic and addressing and meeting families' needs? And then the other aspect was developing a parent survey. So that's still being finalized, and we hope to be distributing that in the next little while. So here's the model for evidence-informed decision-making and public health. And you can see the different circles and how it all combines together to think about something like a COVID pandemic. And so, through the task force work, we're really looking at that yellow circle about what are the health issues, what's happening at the local context regarding our families who were having babies. So the data collection form for healthcare providers were disseminated through the summer. And so we got 42 data collection forms, and each form represents a whole agency or organization. So we heard from 16 community health centers and other community practices like private practices, community breastfeeding groups, such like that, and then 10 hospitals, 8 primary care centers, so that could be nurse practitioners, family health teams, and primary care providers, 5 public health units, and then 3 midwifery practice groups. So one of the questions on this provider survey was their priority concerns. And you can see here when we analyze the results that breastfeeding came up as the biggest concern, and then mental health was the second priority concern, followed by newborn follow-up care. So today, the focus of our webinar is going to be on mental health. And Catherine's going to put in the chat box a webinar that we had a few weeks ago related to breastfeeding. So if you didn't have a chance to look at that webinar, then we encourage you to view that recording. And also on the CMNRP website, there's a bunch of resources that came from that webinar as well that might be of interest to people. The task force to create and to do this work, we looked at the PCMCH, the Provincial Council for Maternal Child Health, postnatal standards. So there's 10 postnatal standards. And then we also looked at the Breastfeeding Committee of Canada outcome indicators. And so we identified 5 additional indicators. And we were looking to see what was happening before the pandemic and what was happening during the pandemic in terms of meeting those standards. So when we look at all the words that people used, particularly related to the priority concerns, we put that into a Wordle, and it showed you the most commonly cited words that people used. And you see that word care, you see the word support and access as commonly being identified for people as priority concerns. And so we have this amazing lineup of presenters for today. And so everyone has about 10 minutes or so. And so if you have specific questions or you need further clarification, please use the chat box. And at the end, Carrie will be able to address those. So she'll be keeping track of the chat as we go along. So I'm absolutely thrilled to introduce you to Amanda DeGrasse. Amanda is an active Family Advisory Committee member since 2015. And Amanda is involved in so many of the regional initiatives. So most recently, the Postnatal Taskforce, as I mentioned, and she's an active member on the Breastfeeding Promotion Committee. She's also a pre and postnatal yoga teacher and a mom of 3. So Amanda, over to you.
Thank you so much, and I'm really excited to be here to share and learn from everyone today. My goal is really to help bring forth the voice of the family. Having been involved with CMNRP's Family Advisory Committee for 5 years now and being on the ground working with many parents and being a parent myself, I really wanted the opportunity to paint the picture a little bit of the landscape of what we're seeing when it comes from a family perspective of their experiences in their mental health during COVID-19 and factors that are causing them stress. And I'll also discuss at the end a yoga and mindfulness program that we have put together to help bridge the gap and offer support for parents during this time. So we'll move forward to the next slide, and we'll move forward one more time. I created an informal survey within my own business. So this is separate from the work we're doing with the CMNRP Postnatal Task Force. I wanted to better understand what are the experiences that families are having as they move through this pandemic, being pregnant, giving birth, in that postpartum period. So you'll see here we had 78 respondents by the time I put this together. We're much, much higher now. A wide variety of people who gave birth over the last few months, and the majority of these people gave birth within a hospital in the Ottawa area, but we did have a subset of people from the Birth and Wellness Center and at home. So moving forward to the next slide, I thought it was really interesting here. It was a pretty even split of those who were experiencing their first pregnancy with those who have experienced pregnancy before but are now experiencing pregnancy, birth, postpartum through the landscape of COVID-19. 40% of parents told us that they weren't sure where or how to be able to access resources during the postpartum period, which I think really emphasizes, again, the need for us to be able to educate and provide resources during pregnancy in a variety of different ways so families feel more supported and readily available to find these resources during the postpartum period. Moving forward to the next slide, you'll also see that, a majority of parents who did access mental health resources during COVID-19 since March, many of those accessed them virtually, 18%, but about 5% were accessing them both virtually and in person. And a lot of people strongly agreed that they didn't know where to access resources should they feel the need to, with another 30% feeling neutral, which as a parent, a neutral response, I kind of interpret that as, did you know when and where and how to access those resources? So moving forward here to the next slide, we also asked, what factors brought you stress during your pregnancy, birth, and postpartum period? And we'll see here as we move forward, I want to point out some key words. And as I do so, allow yourself to reflect back on these three pillars: community, connection, and resources, because we're going to see these three key pillars come up over and over again in a lot of the feedback that parents were providing to us. So as we move forward to the next slide, and we have some quotes that parents and families shared with us, you'll see that they said they were anxious, they were stressed, they were terrified of getting COVID, they were scared of the unknown, unsure if they were making the right choices. And we'll keep moving through to the next slide, not knowing what the hospital experience would be like. They really hated being on their own, which once again is, when we hear they're scared to be on their own, they're unsure of the unknown, that's telling us they don't feel prepared. They don't feel like they have the resources in their back pocket or their toolbox to be able to pull from. They don't feel like they have strong connections within their community to help them feel supported. We're also seeing that a lot of these key pillars, people are wanting to feel like they have effective resources. They want to have that connection. We see a lot of people saying they felt like they were alone. They were waiting alone. They were going to their appointments there alone. They were really starting to feel anxious and irritable. I do want to point out this success, this great feedback that, a parent provided. They really loved the ability to leave the hospital early. So showing that they felt prepared to do so. And by leaving the hospital and going back into their home, they felt that helped them with stress and anxiety that maybe they were feeling. We'll also see here that we want to look at mental health from the whole family's perspective as well. And so we had this family saying, the father experienced severe mental health distress. And when I hear things like that, I think of, kind of the analogy of putting our oxygen mask on, and that if the birth partner or spouse is having challenges and is feeling the need to feel better supported in their mental health journey, then it makes it very challenging for them to be able to help support the birthing person as well. And so really looking at how can we support the family as a whole too. We also asked parents, to share some of their experiences accessing mental health services during COVID-19. We wanted to know what that looks like. And as you will see here, we heard from some that virtual was really hard. They didn't know where to start. So again, they couldn't find those resources, or they didn't know where and how to access those resources. Some felt like it took a little bit too much time to be able to access them. And so we need to think about, as we create our programs and really, look at the landscape of supporting perinatal mental health, how can we make sure that we are able to bridge the gap so people can access those resources, they know how and where to access them, and they're able to do so in a timely manner, because that really, really matters. We did have some people that said they loved virtual. And so, I think it might be hard to think when the days of COVID-19 are behind us and we're in the new normal times, is there the opportunity for your programs and services to maybe offer both virtual and in person? Because I think we've been, it's been challenging for those who are maybe at home with a newborn and other kids to be able to get out. And so they're really loving the option to access services virtually. We're seeing that people are saying it's hard to open up. So being able to be asked more detailed questions help them in opening up. But we also want to make sure that we're creating the community and the connection, because we know when people and families feel connected to us and they feel like they are part of a community, they're more open to letting us into what is really going on in their life and what are they experiencing and how can we best support them on this journey. So as we move forward, we'll go forward one more slide here. I want to talk briefly about how one of our yoga and mindfulness programs is really helping to bring together those three key pillars: community, connection, and resources. There's many studies. I love the study on mindfulness during pregnancy and bringing yoga into pregnancy. This study that was done really looked at a 10-week mindfulness yoga program specifically for high-risk pregnant women. And what they found was that the mindfulness practice and yoga was shown to decrease the perception of pain during labor, reduce physical discomfort, but also significantly reduce stress, which we know when we are able to reduce stress, we're able to support our mental health. Another great study that we have been looking at is the effect of yoga on stress and specifically heart rate variability in pregnant women. And so this study highlighted how yoga really perceived stress can help to support women on their journey. And so this program we created, we wanted to couple the yoga for the mindfulness, the reduction of stress, but also an opportunity for resources and community. So we have a Facebook group where people in the class are able to still stay connected, are able to reach out to build that community, even though we're virtual during this pandemic, and bringing in different experts in the field. We've had midwives, lactation consultants, and helping to bridge that gap for families who are on their pregnancy and postpartum journey. And so I really invite you, as you are creating and modifying your programs to meet the needs of families, to keep those three pillars of community, connection, and resources in mind. So if you have questions, I would love to chat later with you.
Thank you so much, Amanda, for sharing those family insights. It's so important to hear about the experience of the families who are pregnant right now and delivering in our healthcare system. So it's really helpful to hear this feedback, you know, the things that are going well for families and the areas that they're identifying as needing additional support or information on. And I just love that community connection and resources, those little bubbles to be considering. So thank you, Amanda, for bringing in the family voice. Next, we're going to move on to Nancy McLaren Kennedy. Nancy is a peer specialist mental health worker in a women's mental health at the Royal Ottawa Mental Health Center. So Nancy has a Bachelor of Social Work and a Master's of Social Work and is a registered social worker. She's completed the Maternal Mental Health Professional Certificate Training through Postpartum Support International. Nancy is a Safe Talk and RAP facilitator, and she has worked in the following environments: group homes, Ontario Works, hospital, and school settings. So Nancy's going to talk about some of the programs and initiatives that she has been involved with lately.
Thank you, Christina. So today I'm going to have, as part of my talk, an introduction talking about the value of peer support, the collaboration between the Ottawa Birth and Wellness Centre and Women's Mental Health at the Royal, and some of the initiatives that our collaboration has done, such as Facebook Live sessions and some perinatal groups. So the next slide. So I like to start off by showing a couple of photos. I like these pictures because for me, they show the reality of being a parent. So on the right-hand side, I have just given birth to my daughters, and you can see they're wrapped tightly in blankets. I know the skin to skin is now the way to go, and I wish that was available back then. And on the other side, you can see a multitasking parent. I was breastfeeding one of my daughters and reading a book to my son, and my other daughter was getting tube fed with breast milk from my husband. So we were definitely a busy family, and I can relate to the families out there now. Also, after the birth of each of my children, and really in pregnancy as well, I had anxiety and depression. So I had experience with a mood disorder. So on to the next slide. And so the collaboration between Women's Mental Health and the Ottawa Birth and Wellness Center. So at Women's Mental Health, we have 3 areas of focus, as you can see: capacity building, peer support, which I'll be talking about later in the presentation, and research. And at the Ottawa Birth and Wellness Center, there's an individualized approach to childbirth in a community setting. It's a midwife-led facility. For labor and delivery, there's 3 birthing suites and 2 assessment rooms. And they also have a wellness side. And on their wellness side, they offer educational programming. And you can go to their webpage, and they have a calendar as well as explanations about the programming. So next slide, please. So as was mentioned earlier, I'm a peer specialist with women's mental health. So I have lived experience with a mental health concern. We can see that the Mental Health Commission of Canada endorses peer support as an important component of recovery. And peer support works from a recovery perspective and supports a person's wellness holistically. So the person is not their diagnosis. A person is looked at as an individual, and we look at the person in their context. And support is offered from the perspective of, I've been there too. I've had similar experiences to yourself. We look at a strengths-based approach. So some of the questions that would go with that is, how are you managing? What are you doing that's working? And pulling out stories of resilience. So what is working for the person already in their lives? How have they managed to the point that they're at now? And as peers, as a part of peer support, the knowledge of a diagnosis is important. So we can talk about wellness. We can talk about things you can do to support your mental health without a formal diagnosis. And peer support reduces the power differential between people due to the similar experiences. Peer support is also an example that recovery is possible. So I'm a perfect example of that. When my children were small, I had mental health problems. I felt anxiety and depression. I had people support me and use some wellness tools. And I'm here giving a presentation today and supporting women with perinatal concerns in the community. So that's a perfect example of recovery. And also, as we'll see with the groups that is offered through our collaboration, the wisdom comes from the participants in the group. So next slide. So I'm just going to summarize. I know there's a lot of words on some of my slides. I was hoping people can access them later and make sense out of them. So we did receive external funding for this project. Part of the project, the first thing to do was hire a peer specialist, which is myself. The criteria for the role was having lived experience with birth and perinatal mental health concern. So once that was achieved, part of our goal is to conduct a needs assessment on the mental health needs and experiences of women at the Ottawa Birth and Wellness Center. So when we started that sounded straightforward. However, COVID and physical distancing happened. So now we've changed it to what are the mental health needs during COVID of the women and birthing people accessing the Ottawa Birth and Wellness Center. As well, part of the project is to deliver education sessions to parents, birthing people, and also the midwives. So next slide. So what happened? What happened was COVID and physical distancing. So originally we were intending to have our groups in person, our education sessions in person. So that abruptly changed. We were lucky to have an advisory committee comprised of midwives who quickly helped us assess the program and said, you know what, why don't we look at offering the programming on Facebook Live? So we embraced that idea, and midwives looked at their practice and identified what were the questions that birthing people were asking, what were pregnant people asking, what were postpartum people asking. So with that knowledge, we look to the expertise in our community, and you can see some of the topics that we covered. So community resources with Courtney Holmes, who's here today with us. the role of the postpartum doula as well. Thank you for being there. And one of our more popular ones is Ask the Expert, the Pandemic Edition with midwives Teresa and Nicole, which is talking about birth, postpartum, and pregnancy during COVID. And you can see that we got up and running fairly quickly. Our first Facebook Live was on April the 15th. And we were pretty happy to be able to move so quickly. So next slide, just for you to note, and we will be promoting this, advertising this hopefully broadly. We have a Facebook Live coming up on December 10th, which is Understanding and Healing Birth Trauma. So you'll notice that this one's offered in English and French. So Facebook Lives, where possible, are provided both in English and French if the person who is presenting is able to do that. So the next page, moving to the next slide. So as I mentioned before, we were going to be delivering the Wellness Recovery Action Plan as our group and adapting it to the perinatal community. However, the owners of the WRAP program did not want it to be online delivery. They did not allow that. So we looked to the programming at Women's Mental Health that already existed. And there was a journaling as a wellness tool. And we can see here that journaling is an evidence-based tool endorsed by the University of Rochester to help people manage anxiety, reduce stress, and cope with depression. And it also helps control some symptoms. So the program was originally created by Anita Manley and Patricia Stockwell, who are two peers, with 8 sessions of 2 hours each. And this is a closed group. So what we did was Anita and I worked many hours adapting the program to Zoom. We adapted activities, had more check-ins and sharing of personal stories. And what it has developed into is 9 weeks, including intentions, gratitude, self-esteem, emotional vocabulary, goal setting, and of course, evaluation is an important part. And I'll just read a quote from one of our journaling participants. I don't know how I could have gotten through it without this course. Additionally, it has given me the momentum to look past the current crisis, to see a life beyond, and decide what shape it could take. And this is Kathleen Conabare. So on to the next page. So the other group that we had in women's mental health that had run in the past was mothering with a mental illness. So what we decided to do is offer this programming on Zoom. So in order for people to participate, we asked that they sent us their phone number and residential address, and then we sent them the Zoom guidelines, which were for their privacy and comfort of using Zoom. Again, this is a peer-based group, so I'm the peer, and Women's Mental Health lead Anne-Marie O'Brien co-facilitates with me. And we look for the strengths in participants, as I mentioned before, and encourage the wisdom of group members. So rather than Anne-Marie and myself as facilitators answering the questions, providing knowledge, we'll defer to group members. So we'll ask, who else has this shared experience? Does anyone else have something that they would like to add? And we also encourage group members to connect outside of the group. So we ask in the group for permission, and then I'll send individuals an email. If they provide me with consent, then I will share the people's addresses who have provided consent. And of course, we have ongoing evaluation. So we are constantly asking the questions in the group. How effective is this? Are we on topic? That sort of thing. We also have survey monkeys throughout the participation and when a group member exits. And we also receive feedback through emails. So some of the topics that have been suggested and discussed include boundaries, family traditions, gender roles, becoming a mother, COVID and the impact on pregnancy, birth, and mothering. So we currently have 2 perinatal groups that are operating. And our format is a check-in at the beginning, a discussion of topics, and then a discussion of topics identified by participants. Oh, and actually one other thing I'll just mention, we're also going to be offering an educational session on perinatal mood and anxiety disorders to participants' partners. Thank you.
Thank you so much, Nancy, for sharing your personal experience. And it really drives, I can tell it drives your passion for helping other families who are experiencing similar things. So you're such a strong advocate for families in our communities and making sure that they get the help and support that they need so that they can achieve the highest level of wellness. So congratulations to all the work that you do. And I included here a quote from Tamara Brown, the acting executive director from the Ottawa Birth and Wellness Center, who says, "I'm so impressed by all the work that's being done to support perinatal mental health in our community. I'm thankful that during this stressful time, the healthcare community has stepped up to ensure that extra supports are available for those who are struggling. It's really quite inspiring, sorry." And so it is impressive. And so it's like, it takes a whole bunch of different strategies to meet the needs of families. And so Nancy, you were talking about the value of peer support and people with lived experience. Next, we're gonna move on to talk about two presenters from Mothercraft. So Mothercraft of Ottawa Carleton is a charitable nonprofit organization founded in 1944 with the purpose of enhancing the well-being of families through responsive, high-quality programming and services aimed at parents and their children from pregnancy to 12 years of age. So Mothercraft Ottawa has been supporting the evolving needs of families in Ottawa through our diverse child and family services, including comprehensive prenatal and parenting classes and workshops, perinatal support, programming for children with special needs, and an array of programs and services offered through the Early On Child and Family Centers. So the first speaker will be Courtney Holmes, who's the Family Outreach and Birth Companion Support Worker. She's also a birth and postpartum doula and prenatal educator. After her, we'll have Susan Martinson, who's a certified postpartum doula. She's the past president of DONA International, and she's the facilitator of Mothercraft Ottawa's postpartum support drop-in. So welcome, Courtney and Susan.
Hi, thank you for having us, Christina. So Susan's kind of gonna talk about, sort of give you the bulk of what we do in group. And I'm going to give you just kind of an overview of how we got rolling. So pre-COVID, we offered 2 postpartum support drop-ins in person. So we had one in our Westboro location and one in Barrhaven. In addition to that, we also had a private Facebook group for participants that were coming weekly or whenever really they felt the need to drop by to those drop-ins. So when COVID hit, Mothercraft closed their doors as of Friday, March 13th. Within 11 days, we were able to offer our first virtual postpartum support drop-in, which is amazing. So that took place on Tuesday, March 24th, which we're very proud of. And because that, I'm sure, well, it still is a precarious time, but it was such an intense moment in time, especially for folks who had just delivered, we opted to continue with our 2 groups weekly, but we sort of designated 1 day a week virtually to COVID-specific concerns. So folks who are really needing to ask questions and immerse themselves in all things COVID. And on the flip side of that, the other group that we offered within the week was for folks who were not wanting to talk COVID at all. So it was more general perinatal mental health. And that worked very well for quite a while. So essentially over time, we started to, and that when we piloted that first virtual group, it was very much just for folks who were already coming to group regularly. We didn't put it out to the community yet. So we were sharing Zoom links through that private Facebook page. So we had a combination of folks would reach out to me. I think I'm still the primary contact for the group, and or Susan, to obtain that link for that week. But we noticed that, lots of agencies were getting in touch saying that they were interested in referring folks for perinatal mental health services. I was getting emails and phone calls daily, folks wanting to obtain services. And so essentially then we went to a registration model using Eventbrite, where that link was then sent to folks who had registered for that particular group. And we still are operating in that same capacity. So as time went on, we noticed the numbers in the COVID specific group started to dwindle a little bit. Also because the topics that were being shared they're kind of intrinsically connected to COVID stress. And so we extended our sessions. And so we're doing 1 day a week, which is Wednesdays. And we've extended that time to tack on a little bit of COVID specific time at the end. And that is working. That's a really great model that we've been using and continue to use. We also started to see a pretty steady increase in new folks coming. So when we were doing it in person, we kind of had cohorts. Folks could drop in, they could come multiple times in a row. That was welcome. But as their children got a little bit older, so they would sometimes move on out and new folks would come in. Whereas we noticed that with the virtual, we're seeing new people every single week. So I would say on average between 3 and 5 new people come every single week to the drop-in, which is an increase from when we were doing in person. And on average, the number of participants is between 8 and 15 weekly. Of course, there's some fluctuation, but that is on average between 8 and 15 women each week coming to group. We were also seeing an increase in partners reaching out, so partners and dads saying that they were needing some perinatal mental health support and or wanting some tips and tricks and tools on how to support their partners who had recently had babies. So while we did try a drop-in style, virtual drop-in style for partners and dads, the numbers were quite low. However, when we went to a monthly workshop format, we saw 4 times the number of participants registering. So that has continued to be an excellent program that serves sometimes the couples, and Susan can talk a little bit more to that. Sometimes it's couple specific topics, and sometimes it's very specific to dads and partners. So that's kind of where we started from, where we're at right now. I'm going to toss it over to Susan, who can give you a little bit more of an idea of the folks that come in and some of the topics that have been really prevalent during this time. Your mic, Susan. This is part of our shtick. We do this every week. Your mic, Susan.
So our virtual group actually offers the same format as the in-person group. And that is drop in, come on time, come anytime, relieving the pressure and making it more flexible for people to come into the group. And they can pop on and off screen anytime, maybe for self-care or baby care. So that's something that's added to it. It's easier for them to do that. And having the ease of access, no barriers to attending the group, no matter where they're staying, residing. We even have had one mother attend in her parked vehicle because that was the only place that she could go where she could get good internet connection. And then also social distancing is a given. So we would have had to worry about that if it was an in-person meeting. So that took that stress off of us. And also interacting with peers and new people, same as always. Same ability to ask questions, share stories, and support each other. We've been able to accommodate families long distance within Ontario as a result of this virtual platform, in that we have people who were in Ottawa who had friends who were isolated and struggling in different areas. So we were able to invite them to attend the group also, which was probably, I'd say, one of the more significant bonuses, if you like, of having a virtual platform, because we were able to, the early years program is a provincial program. So to actually be able to offer that has been an added bonus for us there as well. And for the people who can come to the groups. The smaller communities, people are feeling a little more isolated, and they are referred to us by members of the group. So it's still sort of a referral basis as such. So communications regarding our meetings and resources are all maintained through our private Facebook page, which has been up and running since not long after the group started several years ago. So new members continue to be invited and added. And it was a major benefit for immediate communication when the changes were coming into place. We already had our group right there available with one stroke of a key on the computer. That was very helpful for us and for them as well. And it broadens our supports again to those who feel. Oh, I'm sorry, I jumped ahead here a second. So it was a major benefit for immediate communication, and then also as well for the usual lines of communication. And it has enhanced the building of community and subsequent expansion of communications. So we're strengthening and generating new relationships and friendships. To even say that 2 o'clock in the morning, somebody can go onto the Facebook page and post something and somebody else is going to be awake. So those conversations can be exchanged in on 24-hour periods. So that has, that's something that has always been there, but especially we're very grateful that it's there now in this time when people need to reach out to each other a lot more. And that one of our upholding principles for the group is community. That's our major focus, was to build community for a lot of these families. And in this time, it has, I think, saved a lot of people. And so the benefits of being in their home, they can put their baby to sleep in a bassinet or a crib, or they can go get some food and they can step in and out. So that's also been helpful. And not having to go out in extreme heat or extreme cold, they can stay in the comfort of their own environment. And partners and family members who may be at home can also help with looking after any toddlers that might be at home, or even the baby if the mother needs to have some support there, or crying or distraught or something like that. So partner support, our drop-in format was not that well attended, and Courtney was alluding to that earlier. So we switched to the monthly evening workshop model. And they've been well attended. And they any handouts can be emailed after the workshop to them. It transfers well into virtual, and we suspect the attendance may be higher because it's virtual. And again, Courtney, I'm kind of repeating what Courtney said there, so I'm going to just skip over that into some of the challenges that are expressed during these times. And access to more services in the city, what can help them. And they're looking for that because a lot of the access has been taken away from them. On top of postpartum challenges, isolation, the loneliness, the grieving of mat leave, I hear all the time, you know, this is something that people were looking forward to, and their energy levels are down. It takes less effort for them to come into the virtual platform than it would if they had to actually try to go out somewhere. And again, supporting with their peer support. Okay, so I think I've taken up my time here, so I will hand it back over to you.
So much, Susan. I think you and Courtney talk about how fast you were able to flip the model, which is always so impressive. So the quick turnaround to being able to continue to offer services, and that word community came up. I mean, that's what Amanda was talking about right at the beginning, the importance of that connection. That didn't go away just because there's a pandemic. And in fact, it's even more important. So thank you for sharing the insights about grief, you know, about the mat leaves and people's vision for even like how that pregnancy was going to go, that birth, that time after birth, like that's really been shaken up for people. And I think we need to really acknowledge that, and it will be a grieving process for them as well. So switching gears now, we're going to go back. I think we all appreciate the importance of this, but I'm delighted to welcome Greg. So I'm just going to switch my screen over here. So go back to our presentation here. And so Greg Lyubimov is the executive director of the Phoenix Center for Children and Families. It's a children's mental health center in southeastern Ontario. And the Phoenix Center provides a wide range of services, including day treatment, respite care, intensive services, early years programming, outpatient, and prevention. And so Greg has over 40 years of experience in children's mental health, adult mental health, and child welfare, where he's been involved as a clinician, a trainer, and an administrator. So Greg graduated with his Master of Social Work from the University of Toronto, and he's known as a passionate and knowledgeable presenter with a focus on making content concrete, practical, and fun. And so Greg's going to kind of wrap up our presentation today by talking about, why mental health matters. So Greg, I'll stop sharing so we can see you here. And we just need to unmute. You're still muted there, Greg.
There we go.
Perfect. Thank you.
So, I know we just can't get it. Eh?
We'll keep
we need
practicing.
Need another 500 practices. Thank you so much for inviting me. And this is such an important topic in my life. I come from a family of 10 children. My wife is from a family of 13, and we have we've had 5 children. So that was my greatest experience in learning about the importance of mental health, not just for parents, but also for our children. But it also comes from my experience in, again, working for 40 years. And I started when I was 10 years old. So I'm about 50 now, I guess. And in not too long ago, the year 2000, he did a study, a national study from Investing Kids on parenting and the condition of parenting in Canada. And what was found after interviewing thousands of parents is that the majority of parents in Canada were lacking confidence, skills, and knowledge, and that they were really feeling unsupported by the government. There was a myriad of services, many which weren't accessible or weren't affordable. And this was affecting their parenting, but also their mental health. They were stressed. They were Googling for information. And if you Google anxiety and you get 2.8 million possibilities. And some of the sites are great and some of them are not great. And some of them are actually quite harmful. And again, confusing for parents. In recent research, there's called the ACE study, the Adverse Experience for Children. And it's clearly telling us that the first few years of life of a child are so critical for long-term in terms of their health, their mental health, their ability to perform, their ability to finish education, their ability to have healthy relationships. And as parents, what we want is our best for our children. I also had the great opportunity of working, I share with you, in an online program for prenatal and early parenting, at which time I was able to delve into lots of research, into information, talking with new parents who were pregnant, talking with new parents who had children recently, and better understanding both myself and what I went through as a parent, but also what some of the issues are out there, and the marvel of the magic of how important mental health is. We often think of helping children around 2 years of age with their mental health, mental wellness. They have language, they're walking, they're talking, they're catching, but it starts before that. It starts before 6 months. It starts before birth. It actually starts in pregnancy. The mental wellness of your child is very much associated with the pregnancy, with the mental wellness of the mother, with the wellness of the environment that they're in. And the brain is developing, in particular in the 3rd trimester, and the child is actually remembering things. I remember a study I read, and I actually then did this with my children, about singing a particular song. When your child was active in the mother's stomach, when you want to settle down, find a nice little lullaby. And I would actually put my hands on my wife's stomach and I'd sing a nice lullaby. And the baby would actually quieten down. I did that hundreds of times over the pregnancy. And then sometimes when you wanted to touch the baby and you wanted to kind of move and feel it, you know, would sing a little bit rocky song, and the baby would start to move. And what's amazing is when the baby was born, I would sing different songs and the baby didn't have much reaction. But when they were wanting to be settled, if they sang that same song, they remembered it. And they actually have studies to show that the babies remember. They remember actually storybooks if you read the same storybook over and over again. So their impressions, their learning is happening early on. If mother is stressed, baby will have more stress. If partner is stressing mom, there's going to be more stress for the baby. We also know that in terms of life is not easy. Who doesn't have stress in life? Anxiety with COVID has amplified tremendously, but it was there before. Anxiety, depression, connecting to our child. What if there's health issues for the mom? What if there's health issues for the child? What if there are problems in terms of the child's not sleeping? Parents are just tired. Their battery is low. How does that affect their connection to the child, their connection to themselves, and self-care? We know that relationships have conflict. We know that there's financial issues. We know the car doesn't start. In COVID, you couldn't find toilet paper. All these things impact how we are feeling, not only about the world, but it actually ends up us feeling about ourselves. And so many parents I've talked to, they have a child who has some mental health challenges, and they feel guilty, they feel embarrassed, they feel ashamed. And one of the first pieces I try and work with them on is to say, don't feel that way. This is not your fault. You didn't intend this. You didn't create this. Yes, maybe there's some things you need to do differently, but every child is unique. Every child is different. Every child is born, every one of us are born with a particular temperament. And that's connected to our mental health wellness. There are some children who are a little bit more internalized, quiet, shy. There's other children who are more externalized. They're more noisy, they're more active. There's children who get upset very quickly. There's children who get upset very slowly. There's children who take a long time to recover. There's adults who take a long time to recover. So our temperament tends to stay with us for a long time, but the temperament based, connected to our experiences in life, how they are related to what they are experiencing, how they process that experience, all form their mental health and wellness. Children looking positively at life, looking positively at having a negative experience to be able to say, I can get over that, or I can get support from somebody. If parents are tired, if parents are anxious, if parents are depressed, then it really becomes difficult to provide the things that the sort of the foundation for your child to feel those things as well. So in terms of mental wellness, is it important? I think it's actually more critical than physical wellness. If I think of individuals who have lost limbs, who have cerebral palsy, who are blind, who are not able to hear, and I see some amazing people who are politicians, who are actors, who are singers, who are musicians, who are artists, who create, who are giving speeches and motivating people across the world. So we can get over our physical limitations, but only if we have mental wellness. We have children who might have ADD, they might have FASD, they may have autism spectrum disorder. I shouldn't be using all these labels. So we have children who have challenges that they are genetically born with. And these are also loaded to create risks for them, risks in terms of making friends, in terms of doing well at school, in terms of learning, but also in terms of how their parents can get, if you have an autistic child that doesn't like to be hugged, this is really difficult for a parent who wants to try and reassure a child and hold that child, and when they're crying to try and calm them down, but they're not responding to that. And that parent then feeling like a failure, or feeling like they're doing something wrong, feeling, what did I do? Did I eat the wrong thing when I was pregnant? Guilt is a huge mental health anchor for many of us. And so thinking about your mental health, your partner's mental health, your child's mental health is absolutely critical. So many people with mental health challenges, they're feeling sad, they're feeling empty, they're feeling hopeless, they're feeling helpless, unfortunately feel that there's something wrong with them and they are different than anyone else in the world. What they need to realize is that they're just one of millions, and that is nothing to be ashamed of, and reaching out for help is the best thing that you can do. And there are agencies, organizations, many who you've heard today, who are able to do that for you. Knowing that there's someone else who is experiencing the way you are is such a normalizer. It's such a relief to say, oh, I'm not alone. COVID, though, has made this a big issue. COVID has created more isolation. It's destroyed a lot of our social support systems. And this is one of our challenges as service providers and as families, to try and find creative ways of closing that gap. So I do very much welcome you to think more about your mental health, your child's mental health. And if you are struggling, reach out. If you see someone else struggling, help them to reach out. So thank you.
Thank you so much, Greg. I think it puts it into to context, especially the research base, like the adverse childhood events. You know, that's the link to chronic disease later in life too. And so that's very strong evidence to say that, among many reasons, you know, it's so important to be mindful and to be supporting people with mental health, even ourselves as parents and our families that we're caring for. So thank you for giving us that larger context of it. Why does it matter? It matters a lot. So we have a few resources to share, and I'll invite Hiltrude Dawson. I see that she's joined us today. I don't know, Hiltrude, if you want to speak now, or I can share a couple resources first.
I can speak if you want. We don't have a lot of time anyway, so I'll try and be fast. Obviously, perinatal mental health is a very important topic, dear to my heart. That's how I started at Health Nexus 15.5 years ago. And we did a big public awareness campaign and videos, so you know the resources that are on the Best Start website about perinatal mental health, including during pregnancy, which is very often overlooked. So, you know, depression, anxiety very often happens already early on during pregnancy and then just continues and often gets worse afterwards. I couldn't join yesterday because I was actually on a national panel moderated by Andrew Picard, the journalist, on perinatal mental health. And I just want to say it's great to see so many resources in the Ottawa area. There are a lot of resources and a lot of services out there, and it's great to see the priorities. Like some areas and some organizations haven't continued these priorities during COVID, but others have really stepped up to the plate, and your area has done an amazing job. And I just wanted to share that together with Life with a Baby, which is a parenting organization, they started because of this topic, around this topic as well. They have chapters across Ontario and in other provinces. Together with them, we've been creating a peer support guide for people providing virtual peer support on perinatal mood and anxiety disorders. So for other parents, we have done one set of training where we had 2 from each province attend. We just wanted to keep the group small. We will be offering a second training because there's a bit of a waiting list already, and we will we'll offer a second training in December, and we will have recorded option of attending the recorded training and access to materials afterwards if anyone wants to take that into consideration. I think the one thing we should all advocate for is to have some kind of coordination of all this. Wouldn't it be great if we could implement this all right across Canada? There's so many good ideas and things, and then there's some areas that have absolutely nothing for mothers, so which is so sad to see. So let's work together and somehow bring this all together. Thank you.
Oh my God, Hiltrud, that's perfect. And it's so great because we do have a number of people from out of province as well who registered for the webinar. So thank you so much for promoting the amazing resources through the Best Start Resource Center, Health Nexus. Interestingly, I was going to share a few, not Life with Baby, but I do want to direct you to the Best Start Resource Center. They have a whole web page on mental health resources. So there's 25 results. A number of them are webinars, but there's also resources like handouts. Here's a screenshot of a very nice handout that's bilingual. I know you can't see the writing because it's a little bit small, but it has these checkbox, how do you identify what this might be like? It's so common, right? Perinatal mental health, anxiety, depression. Like, so what does that actually look like? And who do you call is the other piece. So there's a nice screenshot there. So it doesn't matter where you're living. There's public health units across the province. There's helplines. There's call centers 24 hours a day, 7 days a week. And so we need to be promoting those services in addition to what's available in our local areas. I do want to draw attention to an online course that's been developed by Best Start. So it's called Supporting Parents When They Experience Mental Health Challenges. This is a free online course, and it is only available in English at the moment, but you can see on this slide that there's 3 modules. So you might be interested in taking this online course and telling your colleagues about it as well. I do want to promote a webinar that's happening tomorrow by the Registered Nurses Association of Ontario from 12 to 12:45. I just caught my attention because it's so relevant to what we're talking about today. There's a session called Capacity Building and the Implementation of the Assessment and Interventions, Perinatal Depression, Best Practice Guideline. So we will send that link out to you. I think Catherine just put that in the chat box for you. I understand that they're still accepting registrations. And this all has to do with implementing this Best Practice Guideline that was released just 2 years ago. So I think it's very timely for what we're talking about today. We've had an amazing conversation, and I just want to ask Carrie Ann if there's any specific questions that have come through that we want to ask our presenters about.
If anyone has questions, you can go ahead and put that in the chat, or if you'd like to unmute, you can. The only other question that I received in the chat was about whether the recording would be available, which it will be. So I popped the link for that into the chat for people.
And so we are available to connect you with any of the speakers today. I want to tell you about a webinar part 2 that we're having. We're going to continue the conversation about supporting mental health during this pandemic. So Wednesday, November 25th at 4 to 5 through Zoom again. A few of you have already registered for that. Catherine's going to pop the link in the chat box again, just in case you weren't aware of that. We have another phenomenal lineup of speakers. And the focus for next week too, we're going to continue to talk about the importance of linking families during pregnancy, but also what do you do or what's available if someone needs more intensive counseling and support. So we have 2 specialists who are going to talk about their programs in Kingston as well as the Ottawa area. So I just want to thank you so much. Thank you to our amazing panelists for the work that you're doing each and every single day. It's so inspiring how fast you were able to flip to respond to the needs of families in our communities and beyond. I'm so amazed with what we can do with virtual care and services. And we've learned a lot along the way. I want to thank my amazing colleagues here at CMNRP, Carrie Ann Berga, Catherine Gascon, and Ariane Cloutier. For the behind the scenes support that they've been providing for today. And I've included the email on the bottom, cmnrpinfo@cmnrp.ca for any of the questions or if you want the contact details of our speakers. So thank you so much for joining us today, and we'll continue the conversation next week. Thank you, everyone.